Hi, Mr. Smith.
Hello.
How's your day going?
Good, how are you?
Great. So what brings you in today?
Kind of having a little itchy eyes and kind of some neck pain.
Okay. All right. When did you notice that started?
A couple weeks ago, just at work, I stare at computers all day. So,
Oh, okay. What do you do for work?
inside sales, but you gotta stare at the computers and I don't know,
Oh, man. How many hours a day do you stare at a computer?
probably at least 5, 6 maybe.
Boy. Yeah. So noticing just some is it pain or watering in your eyes?
Yeah, kind of like pain, watery, and like they kind of feel tired, but I'm awake.
Okay. And in your neck?
Yeah.
Just some generalized neck pain?
Yeah.
Okay. Can you point to where it hurts on your neck?
Realistic, just all kind of all over.
Right back there?
Yeah.
Gotcha. And how long has it been going on for?
A couple weeks maybe.
Okay. Does it come and go, or is it all the time?
Pretty persistent, I'd say.
Okay. And with your eyes, is it a dull pain or is it a sharp pain?
I'd probably say more of like a dull, achy pain. I don't know.
Just kind of feeling like your eyes are tired and.
Mm-hmm.
Okay. And with your neck, is it sharp or?
Kind of a mixture of both at times.
Okay. How would you describe it?
Just kind of like a dull, like I don't know, like a muscle pain maybe.
Okay. All right. And what makes it worse?
Just being at work.
Being at work?
Yeah.
Okay. Is it relieved by anything, like when you lie down or?
Yeah, when I lie down, it's a little better.
All right. With your eyes, does anything help your eyes feel better?
Rubbing them, I kind of bought some computer glasses that kind of filter some of the light off, and that seems to help a little bit.
Okay. When did you get those glasses?
A few days ago.
Okay. And you've noticed a good improvement since then?
Mm-hmm.
Okay, that's good. And what else have you tried other than the glasses for treatments? Have you taken any like ibuprofen or Tylenol for the neck or?
Yeah, but it's really kind of just still persistent.
Okay. How often do you take over-the-counter medicine for it?
A couple of times a week, maybe.
Okay. All right. And do you have any other symptoms?
Those are the only two.
Just the eye and neck pain?
Mm-hmm.
Gotcha. And the pain doesn't radiate anywhere else, right?
No.
Just in those areas.
Mm-hmm.
Okay, Mr. Smith, I'm going to start with just go over a brief history here, and we'll try and figure out what's going on with you, okay? And before we get started, what are your goals for this visit?
To resolve the pain.
Okay, all right. Were you looking for medicine or just some advice or a combination of that?
Whichever honestly helps.
All right, sounds good. Well, I'm just going to ask you a few questions, and you can answer yes or no or elaborate as much or as little as you'd like, and we'll try and get to figuring out what's going on with you, okay?
Yeah.
Alrighty, when you were a kid, did you have any vision problems?
No.
Did you ever experience blurred vision?
No.
And did you have any muscle problems when you were a kid?
Nope.
Or notice any pain in your joints or anything like that?
Mm-mm.
Alrighty. Did you get all of your immunizations?
Yes.
Alright, have you gotten a flu shot this year?
Yes.
Okay, great, that's awesome. And have you ever had any surgeries?
No.
Never. Have you been hospitalized for anything?
No.
Or any serious injuries?
Nope.
Especially to your head or neck?
Mm-mm.
Okay. Are you taking any prescription medications?
No.
Anything over the counter other than the Tylenol that we discussed? No. Okay. Vitamins or supplements?
Nope.
Do you have any allergies to anything?
No.
Not to food or drugs or anything
Nope.
like that? Okay. And at your job, we talked about being exposed to the computer a lot. Are you exposed to any other type of toxin, any chemical toxins, or a lot of sun? Okay. All right. Does anyone in your family have any vision problems?
No.
Or any musculoskeletal, anything with their joints, arthritis, anything like that?
No.
All right. Has anyone in your family ever abused drugs or alcohol?
No.
Or is there any history of mental illness?
Nope.
Okay. And we went over your job. Are you currently married?
No.
Okay. Are you using any substances like alcohol regularly?
No.
Or smoking cigarettes?
Nope.
Okay. Do you use any other tobacco products like chewing tobacco?
No.
All right. And in your free time, what do you do in your free time for fun?
Kind of lift weights and hang out with friends.
Okay. So nothing that would really be affecting your neck or your eyes too much.
No.
When you go to the gym, do you do weight bearing exercises that could be affecting your neck?
No.
Okay. So when you're at work, what kind of posture are you sitting in?
Just like kind of a rounded back chair. That's
Okay.
pretty much it. Usually try to sit straight up as much as I can, not hunched over.
Okay. Sometimes you have to kind of strain to look at your screen a little bit.
A little bit.
Okay. All right. And is anything stressing you out other than these current problems?
No.
Okay. All right. Well, we'll just go over a brief review of systems because I think, we've established you here as a patient before. So we'll just go over some of the things that are really seeming to bother you. Are you having any headaches associated with this neck pain and eye pain?
Yeah, a few.
Okay. Could you describe those headaches?
Just kind of a dull headache, I'd say.
Okay. And when do the headaches start?
Usually when I'm staring at the screen after a few hours.
All right. And do they go away, or are they just kind of, do you always have a headache?
No, they kind of just come and go. It just really varies on the day.
Okay. Are you experiencing any dizziness?
No.
All right. And we went over that you haven't had any head or neck injuries in the past or recently. All right, well, in your ears, are you having any ear pain?
No.
Any discharge or fluid coming out of your ears? Any loss of balance recently?
No.
Okay, any redness or swelling around your ears?
No.
All right, when was the last time you had your hearing checked?
I have no idea.
No idea. So probably not for a few years. Okay, gotcha.
Probably.
Have you traveled in an airplane recently?
No.
All right. Does noise sound hollow to you, or have you had any change in your hearing?
No, it's pretty much stayed the same.
Nothing like that. Okay. Are you exposed to loud noises often? Do you use headphones to listen to music?
Mm-hmm.
Do you turn it up excessively loud, or?
No.
No? Okay. And how do you clean your ears?
Just Q-tips a couple times a week, maybe.
Okay. All right. And onto your eyes. So you said that you're having eye pain, kind of watering eyes. Have you had any changes in your vision?
Not that I can think of. Just like itchy hasn't really affected the vision. It's just kind of like more hurt my eyes.
Okay. So like you're still able to see everything adequately, but just sort of that pain. Okay. No history of crossed eyes?
No.
Or seeing double?
Nope.
Okay. Do you use glasses or contact lenses?
Yeah, work use computer glasses.
Just the computer glasses. All right. Okay, and we're not having any problems breathing or anything like that?
No.
All right. And in terms of your allergies, you've never had seasonal allergies?
No.
Never had anything like that? All right, well, we're going to move on here to a physical exam. I'm going to be looking at your head and your neck muscles, as well as doing an eye exam and an ear exam. Are you okay with that? All right. So first we're going to start off with your head and neck. So I'm just going to kind of look over your skull and palpate a few areas with my hands. Is that all right?
Sure.
Okay. So I'm just seeing if there's any noticeable lumps or anything like that. Can I have you open your mouth and close it? Great. All right, I'm going to be feeling your lymph nodes for any swelling. All right, can I have you tilt your head to your right? All right, and to your left? Great. I'm just going to try and feel these lymph nodes down here in this area. All right, Mr. Smith. Can you tilt your head, try to touch your ear to either of your shoulders? Okay. And bend your neck, try to touch your chin to your chest. Great. Does that cause you some pain there?
A little bit.
Okay. And try to extend your head back. Any pain with that?
Yeah.
Yeah, okay. And now I'm just going to try and test your muscle strength. So I'm going to have you shrug your shoulders, and I'm going to push down on them, okay?
Okay.
So go ahead and shrug. Good. And now I'm going to have you try and turn your head to the right and to the left, and I'm going to resist you, okay?
Okay.
So go ahead and to the right. Okay. And to the left. Great. Okay. All right, Mr. Smith, I'm just going to have you scoot over toward this side and try and face the door there. I'm going to stand behind you, and I'm just going to palpate your trachea and your thyroid, all right? Okay. And I'm going to get you a glass of water, and I'm just going to watch and inspect your trachea, okay?
Okay.
I'll be right back. All right, I'll just have you swallow that and try and tilt your head back a little ways if you can. Great. All right. And now I'm just going to take a listen to your trachea area, to your thyroid, with my stethoscope. All right. Okay, Mr. Smith, we're going to move right on here to your vision test. So I'll have you stand here by this chair. And I will give you a little covering tool. I'll have you cover up one of your eyes while we do this. We're just going to test your vision. So whichever eye you want to cover up. And I'll have you read this line here, whichever one you feel most comfortable with. We'll start with this one. Can you read that line to me?
Yep. It's DEFPOTEC.
Great. And now switch eyes.
DEFPOTEC.
Great. Can you go down to this line?
Oh no.
Okay. All right, that's fine. All right, have you take a seat. All right, we're going to move on to another test here. It's called the confrontation test. So I'm going to just, I'm going to hold my wiggling finger in the middle here, and I'm going to move it up and out of your vision. And when you see me move it back and you can see it in your peripheral vision, tell me, just say now, okay? Okay, let's try that one again.
Okay.
Okay.
Now.
Okay.
Now. Now. Now.
All right, great. And all right, I'm just gonna look at your cornea. I'm gonna be shining a light into your eye, okay? So just stare straight ahead at that sign right there. All right. Great. And I'm going to dim the lights in here, and I'm going to look at your eyeballs again, okay? So stare straight forward, right there. Great. Mr. Smith, I'm just going to have you follow my finger with just your eyes, okay? Don't turn your head at all. Great. Alright, I'm just going to inspect your eyeballs now. So I'm going to be pulling down on your cheeks a little bit, okay? I'm going to be looking at these underneath parts, so just try and keep your eyes open. Alright, and look up. Great. And look at these upper parts. Look down. Alright. And focus on this sign right here. Open up your eyes real big. Okay. And now I want you to look at my finger right in front of you. Great. Alright, Mr. Smith, we're going to start the ophthalmoscope exam, so I'm going to be using this instrument to look into your eyes. You might experience some slight discomfort, and if that happens, just tell me, hey, let's take a break, okay?
Okay.
Alright. And just focus past my shoulder on that sign back there. Okay, so we're going to look at your ears just to make sure there's nothing going on there that could be causing you a headache or be associated with any of these problems, okay? So I'm just going to look into your ear with this instrument again. I'm going to switch it out. And when I pull on your ear, is there any pain?
No.
Okay. Alright. So I'm going to pull your ear up and back. Okay. The other one. This popped off, so try that again, sorry. Alright, your ears look good. Alright, so now I'm just going to whisper a couple of words, numbers and letters into each of your ear, and you just repeat them back to me, okay?
Okay. 3-4-B. 8-6-B.
Great. And normally we would be doing a tuning fork test as well, but I don't have a tuning fork. So that test would just be to see if there's a difference between bone conduction and air conduction. And we don't have that instrument here today. All right, Mr. Smith. Well, your eye exam and ear exam both look very normal to me. I don't see any concerning assessment findings. I think you're on the right track with getting those glasses to help you at work, and since you've only had them a couple of days, I would see how that works for you. And I know that it's concerning to you that you're having these symptoms. I wonder if they're really related to how much you're staring at the computer screen and if you're straining your neck muscles at all. And so I would recommend maybe getting a positioning aid, something that can help you really sit in a way that would take the uh-oh. Sorry, I didn't mean to laugh. It's just examples of non-therapeutic communication. Okay. get a positioning aid that can maybe help you sit in a posture that will help relieve the tension from your neck muscles, and using those glasses should help as well. If you're still having these problems in 2 weeks, I would call and book another appointment and we can evaluate you further, okay?
Okay.
Do you have any other, did you have anything else in mind? Or I feel that I didn't give you much of a recommendation, but did you have anything else in mind?
No.
Okay, we just kind of wanted to make sure there wasn't anything going on in these regions.
Make sure it wasn't anything more serious.
Okay.
You know.
All right. Good. Well, do you have any questions or concerns?
Nope. If I do, I'll just schedule another appointment.
Great. All right. Well, it was good to see you.
Yep. Same.
Have a good day.
Yep, you as well.
Okay.
What happened?
Patient Matthew Smith is a 27-year-old Caucasian male who appears to be his stated age. He came in complaining of eye pain and slight watering from his eyes and some dull aching neck pain that he believed to be related to his job, where he spends a lot of time, many hours, staring at a computer screen at a desk. He did state that he had no history of head, neck, or eye injury, no dizziness or syncope. Patient did state that he had limited range of motion in his neck due to the neck pain, but denied any lumps or swelling. On assessment, his head appeared normocephalic with no lumps, lesions, tenderness, or trauma. His facial features were symmetric, no drooping or weakness, no involuntary movements. I did notice some limited range of motion when he, on his head extension, which I'm assuming is due to his neck pain. No lymphadenopathy or masses when palpating his lymph nodes. Trachea was observed to be midline. His thyroid was not palpable. No bruits on auscultation. His patient's eye exam, he stated that his vision was good with no recent change, no discharge lesions. Patient stated he doesn't wear glasses or corrective lenses, other than recently he purchased some computer glasses to wear while he is at work, and he just recently bought those about 2 days ago and had he reported that he noticed it was helping with his symptoms. The Snellen chart exam, his vision was 20/20 in his right and left eye. Fields were normal by confrontation. His corneal light reflex was symmetric bilaterally. Extraocular muscles were intact by the diagnostic positions test. Brows and lashes were observed to be intact and symmetric. No ptosis. Conjunctiva were noted to be clear. Scleras were white bilaterally with no lesions. Pupils were equal, round, and react to light and accommodation. Red reflex was present bilaterally. On the ophthalmoscope exam, I was able to see that the retinal background, there were no obvious hemorrhages or anything like that. The patient stated that his hearing was good. No earaches, discharge, hearing loss, tinnitus, or vertigo were reported. Patient stated that he did not have any recent injuries to his ears either. The ear exam revealed that the skin on the pinna was intact, no lesions, tenderness, or discharge. Otoscope exam revealed the external canals were clear, no redness, swelling, lesions, or foreign bodies, as well as no discharge present. The patient's tympanic membranes were pearly gray bilaterally, with the light reflex and landmarks intact bilaterally. No perforations. The patient responded appropriately to conversation, and whispered sounds were heard bilaterally. Based on my subjective and objective findings, I recommended the patient to continue to use the computer glasses that he purchased for a period longer than 2 days to see if those helped with the watering eyes and dull eye pain, and recommended that he try a positioning aid in his chair to try to relieve some of the soreness in his neck. I do believe that the symptoms that he came in for were most likely related to his occupation, and I recommended a follow-up if his symptoms persisted. The patient verbalized that he was happy with that recommendation.